Hi everyone, my name is Hua-Xin Ng. I'm currently a postdoc research fellow at the University of British Columbia. I'd like to first acknowledge the contribution of all the 10 co-authors of this study. The efficacy of a disease-modifying drugs, or in acronym DMD, is typically established after clinical trials conducted over 2 to 3 years in highly selected groups of patients. However, in clinical practice, these DMD are often used in the wider MS population. The objective of this study was to describe the characteristic of a population with MS exposed to their first DMD in the real-world setting. We conducted the study using linked administrative health data from 4 Canadian provinces spanning from the west to east coast, including British Columbia, Saskatchewan, Manitoba, and Nova Scotia. The linked data consists of 5 datasets as listed here. We identify all individuals with MS aged 18 years or older who failed a prescription for a MS DMD between 1996 and 2018. The following demographic characteristics were captured and described. This table shows the overview of the cohort characteristics exposed to a DMD over the 22-year study period. Most of our study population were women. About 1 in 6 were 50 years or older at the time of their first DMD. The number of people were distributed evenly across the income-based quintile, and about 1 in 6 had at least some burden of comorbidity measured using the Charlson Comorbidity Index. This table shows the sex and age of the MS cohort by DMD class. We observe a variation in sex distribution across the DMD. We also observe a variation in the mean age at first DMD. The last table shows the DMD used by calendar period. The patterns of treatment change between the 2 periods as more DMD become available, with an increased uptake of oral DMD. In summary, we found in our study that 1 in 6 people with MS had at least some burden of comorbidity, and 1 in 6 were 50 years or older at the time of their first DMD. As these individuals are typically excluded from clinical trials, our findings illustrate the need to understand the harms and benefits of DMD use in these understudied groups. Thank you for listening.